Examination of white lesion. Definition of white lesion. White lesion is a non-specific term used to describe any abnormal area of the oral mucosa that on clinical examination appears whiter than the surrounding tissue and is usually raised, roughened or otherwise of a different texture from the adjacent normal tissue. White lesion can be classified as scrapable and non-scrapable lesion. The scrapable lesion includes pseudomembranous candidiasis, diphtheria, thermal burn, chemical burn, secondary syphilis, radiation mucositis, traumatic ulcer, ANAC and erosive lichen planus. Non-scrapable include linea alba, leukoplakia, leukoedema, tobacco pouch keratosis, white spongy nevus, lichen planus, hairy leukoplakia and papilloma. We are going to see in detail about tobacco pouch keratosis. Tobacco pouch keratosis or smokeless tobacco induced keratosis is the development of white mucosal lesion in the area of tobacco contact. The lesion develops on habitual chewing or snuff tipping tobacco. Clinical diagnostic approach includes inspection and palpation. Inspection is defined as the observation with an unaided eye. On inspection, the greyish white plaque is evident in the left buccal mucosa, which extends anteroposteriorly from the mesial surface of 3.3 to the distal surface of 3.6 and supra-inferiorly from the level of occlusal plane to the lower border of lower buccal vestibule. The size is of approximately 5 into 5 cm. The borders are diffuse. The surface of the lesion appears corrugated. Palpation is the act of feeling by sense of touch. On palpation, the above inspectory findings shall be confirmed. The lesion is non-tender, non-scrapable and the lesion does not disappear on stretching and the texture is rough and leathery. Pseudomembranous candidiasis. On inspection, diffuse white plaque is seen in the left buccal mucosa extending from the commissure of the lip to the pterygomandibular raphe. The patch is soft, homogeneous and raised above the mucosal surface with a curd-like appearance. On palpation, the lesion was scrapable using gauze and left an erythematous area behind the lesion was slightly tender on palpation. Chemical burn. On inspection, whitish lesion is seen in the relation to 3-3-3 involving interdental papilla, marginal and attached gingiva that overlaid by a pseudomembrane of size approximately 2 into 1.5 cm. On palpation, it is scrapable and slightly tender, leaving behind an erythematous area.